We're back. You're watching the Jersey City Show. Don't forget our Twitter. We want to build a following of Twitter people. JC Hudson Media, the Medical Center. Probably by the time the show airs, hopefully no decision has been made yet concerning ambulance service for the people of Jersey City. For 130 years, the Jersey City Medical Center serviced all the people of Jersey City, going back with the horse-drawn carriages, and pretty much uninterrupted for 130 years. Now there's some competition. Now the competition, all its joking aside and the name dropping with McCabe Ambulance Services, it is CarePoint. CarePoint owns Bayonne Hospital, the most expensive hospital in the United States of America, Hoboken University Hospital they bought, I think about 2.5 years ago, and Christ Hospital that they've had for a little over a year, I believe. But Hoboken, they've had for a while. Later on, I'm going to do a side-by-side, various procedures. I believe we got these numbers from Medicare of what Bayonne Hospital charges and what the Jersey City Medical Center charges. But it comes down to CarePoint and McCabe Ambulance Service, which I believe CarePoint principals own 50% or so of the McCabe Ambulance Service. Now, the idea here is if there's an emergency, CarePoint would be responsible for the ambulance service. They'll get the medical dispatch. And what we're talking about doing in a nutshell is taking residents, jobs, and money out of Jersey City. Now, the Jersey City Medical Center is state-of-the-art. Christ Hospital, if you ever read the Navigate report, not state-of-the-art. Hoboken University Hospital, not state-of-the-art. These are very old hospitals. Even Bayonne Hospital has some issues there. Jersey City Medical Center is about 7 years old. And like I said, it is state-of-the-art. But really, when you're looking at this, do you want your aunt, if there's some situation in Bayonne when you're thinking of going to Jersey City, now you have to get to Bayonne? And the difference you have here between these two hospitals, which again, this is really CarePoint against Jersey City Medical Center, is a not-for-profit versus a for-profit. Now, again, let me go through the hospitals again. Christ Hospital in no way can handle what the Jersey City Medical Center can do. It's just, it's an old hospital. It's obsolete in design. Not knocking the hospital's medical staff, it just isn't capable of doing the job the Jersey City Medical Center does. It's state-of-the-art, the Jersey City Medical Center. So you would have to take all three campuses, Bayonne, Christ, and Hoboken, to do what the Jersey City Medical Center does for the residents of Jersey City. I don't know how smart that is to do, to try to truck people into Bayonne or trying to get into Hoboken on a Friday night going down to Viaducts. But the for-profit versus, not-for-profit versus for-profit, here's what it comes down to. It's the Jersey City Medical Center. They have the state-of-the-art equipment, state-of-the-art emergency room, state-of-the-art hospital, because they reinvest any money back into the hospital. A for-profit, these guys are buying boats. We talk about the 1%ers, the fat cats. That's the owners of these various hospitals. That's what it comes down to. The Jersey City Medical Center puts their money back into the hospital, back into the community. When, like EMS, emergencies, they're like the gold standard. Their average is like 6 minutes at an ambulance call. The Mendoza line, I think, an old baseball term, is 8 minutes, is what the state and the feds say should be an ambulance turnaround time. They're 2 minutes below that. But when you go to the medical center, you just walk in it, you feel this is a state-of-the-art hospital. When you go into their emergency dispatch, you're in like mission control there. They have programs that will predict where the emergencies are. Now, until recently, I didn't realize how ambulance services work. But they got ambulances stashed all over the place on this computer program. There's like 50 of them the medical center has. And they're sitting in Jersey City on Broadway, or they could be on Montgomery Street. They're in the downtown section of Newark, downtown section of Jersey City and Newport during the day. Then they'll pull some of them out of there at night because, of course, the employment is down. People have gone back to Hoboken or New York, wherever they live. They just work here. and they reposition those ambulances. So when there's a call, they're not zooming out of the medical center. They're zooming out of, maybe Congress Street, Hague Street, wherever they got these units sitting, waiting for that emergency call. But it's amazing when you look at how the two different entities work, and they're going head to head. Now, the City of Jersey City put an RFP, and they keep putting addendums to this RFP. At first, the city wanted a big fee on the ambulance calls. Jersey City people, we know what big means. Chances are that wasn't legal. So now they're turning around asking the bidders to pay for first responders. That's when the fire department comes to the house. And if they're there, somebody's got to pay for them. I thought that was taxpayer funded, but maybe I'm wrong. So there's $2.6 million they're looking to get there. When they wanted to put the big in, it was $2.6 million. Now they're looking for $2.6 million just for the first responder. I'm going to show you side by side. These are prices I believe we got from Medicare, from Bayonne Hospital, which they've owned out there for about 6 years now. So you got good numbers coming out of Medicare, and the Jersey City Medical Center. Now look at these numbers. Now these are various medical procedures. You're going to look at the price at Bayonne Hospital, the most expensive hospital in the United States, owned by CarePoint, charges for the same procedure done at the Jersey City Medical Center. You're going to see a huge difference in these prices. Some of these 4 times the price what the medical center charges. That means if your insurance company isn't paying for it, not only where we're going with Obamacare, because you're going to have to pick up some of this different. If they're going to charge one figure and the insurance company is paying another, what happens to that difference? It happens to you. Again, the real issue with those numbers you're looking at here, I don't know if we're going full screen or you're just looking behind on the green screen behind me, is profit versus not-for-profit. Nobody's trying to get any boats or pay back stocks or dividends or get investment money out of the Jersey City Medical Center. It's all put back. Now, in the case of, I should say in full disclosure, I produced the Med Center TV show here. The Hudson Media Group produces the Jersey City show and the Med Center. It's one of our sister shows. I've been listening to these guys for a year. I'm starting to understand how the medical center works. And they just had a show, I think it's airing this week, with the EMS guys. And they talk about the state-of-the-art equipment, rolling emergency rooms. The Jersey City Medical Center reinvests the money, and that saves lives. Time is muscle. When there's a heart attack, you don't have a couple of minutes to go to down to Biodoc in Hoboken or try to get to Bayonne. Time is life-saving time. And in Jersey City, we want to keep our residents in Jersey City. We want our residents to have the best possible health care. And also, I think this affects the reopening of the Greenville Hospital. So we got a lot on the table with the Jersey City Medical Center. I hope Mayor Fulop is listening. We're going to break for commercial. We'll be right back.